Welcome to Body in Balance Podcast. I am your host, Charlotte Johnson, the certified licensed physician assistant, sent here to kick some knowledge your way once a week for the purpose of educating, informing, and enlightening this audience concerning physical, spiritual, and emotional aspects of our bodies in relation to our Creator, the one, the only, the true and living God. He is the King of Kings and the Lord of Lords. Let us give it up for Yahweh. Well, hello there. We are ready. We're ready to get started. This is a new season, and we're going to be talking about how allergens affect the nose. How allergens affect the nose. And so there's a lot of information to get started with. So we're going to go ahead and get started now. We're on season 2. And that is for what you need to know about the nose. Season 2, and it says 1, but episode 1, but this is episode 2. So we will be talking about the nose. Let's get started. In our first slide, so what is the working definition that we're going to be talking about? Some of the working definitions are otolaryngologist. Those are ear, nose, and throat. Oto for ear, rhinologist, otorhinolaryngologist, otorhinolaryngologist. So oto is the ear, rhino is the nose, and laryngo is the throat. So those specialists are otorhinolaryngologists, or they're otolaryngologists, or they can be otologist if you're just talking about one or the other. Allergic rhinitis, hay fever, or allergies, an overreaction by the body. We talked about that last week. An overreaction by the body for different allergens, whether it be pollen, whether it be dog dander or cat dander or anything like that. Those allergens can make you overreact, and it affects your immune system. Sinusitis. Sinusitis is the inflammation of the sinuses or all of the spaces in the skull. We'll see that. We're going to go over some CT scans or a CT scan and see what the sinuses do. We'll talk about what the sinuses do in our head. They help with your voice resonance. They lighten the weight of the skull. And then we're going to talk about the turbinates, the 3 structures inside the nose. They're bony tissue that's covered with some soft tissue, and that's the mucosa, which tends to swell when you get colds and flu, or if you're introduced to an allergen. We're also going to hit a little bit of the topic of when the olfactory bulb gets affected. It's one of the 12 cranial nerves that we're going to talk about. That's cranial nerve 1, which can cause the inability to smell, which is anosmia. Okay? So, nasal and sinus anatomy. Noses can come in all shapes, sizes, colors. Of course, we all, as human beings, come in all shapes, sizes, and colors. And so do noses. Now, when you look at the picture in the middle, You see the frontal sinuses, which are at the top on the forehead. Between the eyes, you see the ethmoid sinuses. And then at your cheeks, under your eyes, those are called your maxillary sinuses. Your maxillary sinuses. Now, the 3 stair steps that you see inside that nose that would be your left-hand side. On the left-hand side, those are called turbinates. And turbinates tend to warm up the air. You will see that CT scan to the far right. You'll see the frontal sinuses, the black spaces on a CT scan means that air is there, and that's good. That's a good thing. If it's gray inside there, that means there's infection or mass or polyp tissue. So over the eyes, you'll see the frontal sinuses. Between the eyes, you see the ethmoid sinuses, and the cheek sinuses are there under the eyes. Now, if you look directly in front of you, when we're looking at the middle picture, you'll see the split between the left and the right. That's your septum, your nasal septum, your nasal septum. That nasal septum is right here, and it splits the left and right side. The nasal septum is there to split that left and right. The turbinates are there. You have 3 turbinates on the left, 3 turbinates on the right. An inferior turbinate, middle turbinate, and there's also a superior turbinate. That's what you see on the CT scan. At the bottom is the inferior turbinate, and then you'll see a little bit of the middle turbinate just above that inferior turbinate. All right. Here's a better picture of it because you're looking at the sagittal view or the side view of the inside of the nose. So you're looking at one side of the nose, and you'll see the inferior turbinate at the bottom, the middle turbinate just above that. The superior turbinate is higher than that. So the nasal vestibule right in the front, that's where fingers go. That's your nasal vestibule where air comes through there. Air is warmed up by those turbinates. And then if you look in the back, when we get to talking about ears, you'll see that opening that's in the back of the nose. That's the opening that leads to your eustachian tube or to the middle ear. Now, above that, the yellow there represents bone. It represents bone. The pink represents mucosal tissue. So back behind the sinus, you had the frontal sinus that I could show you. Then between the eyes is the ethmoid sinuses. The maxillary sinuses were the cheek sinuses. But behind the nose, if you look at that, it says there's another sinus, and that's called the sphenoid sinus. That's the one that gives you a headache at the top of your head. So if you have a lot of pressure at the top of your head, you could have a sphenoid sinus infection. If you have infection here in the frontal sinuses, you could have it between your eyes where there's pressure and it feels like something's squeezing your eyeballs. That's where the ethmoid sinus and the sphenoid sinus would be infected. So one side is the side view, that's the sagittal view. And then we look at the coronal view, which is looking straight at you, just like this. All right. So here you'll see how the sinuses are affected. One of the ways to treat them is to use a nasal saline rinse. I have that at the bottom, but other medications that you can use for allergies, for allergic rhinitis, is to use decongestants. Now, I'm very, very cautious in using, I take a lot of caution with using pseudoephedrine with my patients over 40 years old, both males and females. One thing about it, it tends to run the blood pressure up. Pseudoephedrine can run the blood pressure up. If it's greater than 60 milligrams, it's definitely, I don't use more than 60 milligrams because within 4 hours, it'll go out of your system. And so you could be better. However, if you have the 120 milligrams, that'll last about 12 hours. 240 milligrams is 24 hours. And so if you take a 24-hour Claritin, it's going to have 240 milligrams of pseudoephedrine. That's an awful lot for someone that has blood pressure problems. So you want to be careful with that. Make sure that you watch out for how much. I usually tell people don't use pseudoephedrine that is already incorporated in the medicine, like Claritin D, Allegra D, Zyrtec D, Mucinex D. Anything that has the D on it, it has pseudoephedrine in it. And if it says that it's 12 hour, it's 120 milligrams. If it says that it's 24 hours, then it's 240 milligrams. That's an awful lot. Now, for my male patients, I have a high male audience. So I'm telling you that high pseudoephedrine can cause you to have a lot of problems with your prostate. It will make your prostate swell, and it makes it difficult for you to urinate. The Afrin is good to use for about 3 days. I would not use it more than 3 days. If you keep using it, it's going to be hard to get off of it. That's why we say that's addictive, and we tell people not to use it. It's not addictive like a fentanyl or hydrocodone or morphine or oxycodone. It's not addictive like that. But if you don't use it, you end up not being able to breathe. So you get stuck on it. That's why we try in ENT not to use that at all, unless you have a cold. Or I tell people to use it if they're going to get on a plane and fly somewhere and they have problems with their ears. It does help. I have them use it 2 to 3 days before they get on a plane, 2 to 3 days after they get off a plane, and then you will do better. All righty. Expectorants. Expectorants tend to thin mucus so that it's not so thick. You would use Mucinex or Robitussin. The antihistamines like Claritin, Allegra, Zyrtec, Zyrtec, Benadryl, those are all or chlorpheniramine, those are all oral antihistamines. Benadryl is one that causes a lot of drowsiness. Chlorpheniramine does. It has been known that Zyrtec can do the same thing to make people drowsy. So you want to be careful with using Zyrtec. Now, some of you all, it works complete opposite. It doesn't bother you like that. But truly the ones that don't cause any drowsiness is Claritin and Allegra. Love both of those. The reason I prescribe the Claritin a little more than I do Zyrtec or a little more than I do Allegra is because Allegra is a large pill. It's a big old football looking pill, and it's hard to swallow for some people. People that have trouble doing any kind of the oral medications, you can use topical nasal spray. That's azolastine. Azolastine. It's a topical antihistamine, works wonders, especially when you put it with the nasal steroids. When you put the nasal steroid of Flonase, triamcinolone, Rhincourt with azolastine, works wonders. The thing is, it can cause a lot of drying in the nose, make the nose dry. And in the wintertime, that could cause some nosebleeds. I'm careful about using that. The thing about azolastine, you can use it by itself without the nasal steroid. Works great, but it tastes awful. Tastes awful. So I suggest that you spray it. Tip your head down, put the nozzle in, Spray it, pinch your nose about 7 times or so. Use a tissue and blow. That way, the nasal spray won't go into the throat. Don't sniff it. Don't go to make it go into your nose. It's not going up, it goes down. Physiologically, if you tip your head down, the particles have to go up. So if you tip your head down and spray the spray, it goes where it needs to go. I just talked about the nasal steroid working with the azolastine. Now I'm going to tell you something about Flonase. Flonase is a good medicine, but it can cause headaches. It can also cause nosebleeds because it dries out the nose and the nasal mucosa. The reason why is it has a alcohol base. So in order for its solute to be dissolved, they use alcohol. In Nasacort, Rhinecort, those two, they use a saline base, and so a water base. Now, because of that, Flonase Sensimist is a saline-based medicine. So that is less likely to cause headaches, nosebleeds, or to make sores in the nose, like the Flonase will. Let's look at a video, because you know I love to show you all my videos. Let's do a video on saline nasal
Nasal allergies, also called allergic rhinitis, are very common. As you breathe, allergens, such as pollen, mold spores, or animal dander, cause your body to release chemicals that create a collection of symptoms, mostly involving the eyes and nose. Many people with allergic rhinitis also have other nasal and sinus symptoms. Drainage from the nose and sinuses can make rhinitis worse, especially at night. In a recent survey, almost 90% of family physicians recommended nasal saline irrigation for sinus and nasal symptoms. A saltwater nasal wash, or saline irrigation, helps to clean mucus from your nose, decrease nasal swelling, and increase airflow. It can also rinse allergens or pollen from your nose and make nasally administered medications more effective. Regular nasal irrigation helps remove bacteria and viruses from the nose, which reduces the potential for infection. It also moistens tiny hair-like structures called cilia. They pass allergens and other invaders like bacteria to the throat, to be swallowed without causing harm.
All right, great. So we got a chance to see how the saline rinse works and what it does. So let's move on to our next slide. And we're going to talk about sinuses. Let's see how the sinuses work. So in this slide, sinusitis. What purpose do sinuses serve? What's the purpose of the sinuses from what I showed you on the picture? Well, first thing they do is they help to lighten the skull. The weight of your head, you would be a bobblehead doll. We would all look like bobblehead dolls if we did not have the openings in our skull, because the bones would be so heavy for our cervical spine. Number two, they help with voice resonance. So you know when you get a cold, you sound very nasally. You sound more like this, and it's real squishy, and it just sounds like your head is all stuffy. Well, that is the reason why we have the sinuses being empty when they're full with mucus. Or people that have polyps, you'll notice their voice sounds nasally. Three, the sinuses help to produce mucus. which keeps the nose and the sinus passageways from being all dried out. And the sinuses also help to warm up the air before it gets to our lungs. Now, I'm going to tell you how that works. When those of you that go swimming, when you go to the pool, the first thing you do is you go into the shower area. That's not for you to go and take a bath or take a shower. What that is for you to let that cold water hit you because it's 100 degrees outside. Your body temperature is 98.9, 98.7. However, when it's 100 degrees outside, your body temperature rises. But the water in the pool is usually about 89, maybe 90. So it's considerably lower temperatured, which is why we want to go swimming so we can cool our bodies off. If you jump in there right away, then your muscles go into spasm and you can get cramps. That's what happens with your lungs. That's how you have cold induced asthma. Those of you that have asthma, you can get cold induced asthma because the air that gets inside your lungs tends to get your lungs to the point where they go into spasm, and those small little alveoli, which we'll talk about that in a later segment, tend to go into spasm, the smooth muscles. Now, how do we treat the sinuses when the sinus cavities in your head become inflamed, swollen? You have pressure in your head, you have facial pressure, headaches, you'll cough, you have thick colored mucus, drainage that comes out and goes into your throat. That kind of thing, that's an acute sinusitis, and that happens usually after 10 days, 7 days. So say you have flu symptoms, and after 7 days, if they don't resolve and it starts getting worse and you start getting this colored mucus, now you've got an acute sinus infection. If it occurs once or twice per year and goes away after a 10-day course of an antibiotic, that's acute. If it's chronic, it's lasting greater than 12 weeks, and it occurs 5 to 6 times in a year. Most of the time, you might have to see an otolaryngologist because you may have to have, or otorhinolaryngologist, because you might have to have surgery for your sinuses. Treatment for the sinuses are saline rinses, as we just saw. I have people use the saline rinse in the bottle and put 1 drop of baby shampoo, 1 drop of Johnson's No Tears baby shampoo in the saline bottle, only 1 drop, because half of that bottle goes on one side. You close off like your grandpa taught you on the porch and blow. And then you do the same thing on the other side, rinse and close off and blow. What does the Johnson baby shampoo do? I'm so glad you asked me. It acts as a mucolytic. So where the mucus sticks, where that thick mucus sticks and dead bacteria from your antibiotic that's killing those bacteria that's not supposed to be there, that tends to rinse that wall off. Do you know the commercial about the scrubbing bubbles? That's what that does. It scrubs off that mucosal lining. So you can also use saline nasal spray. Antibiotics that you can use. The penicillins are amoxicillin or augmentin. That's the number 1 that we use for sinus infections. Then you have the macrolides, which is the Z-Pak or clarithromycin. The thing with the macrolides, they can be rough on the stomach, so you got to make sure you eat with those. If you don't, they will make you sick to the stomach. Amoxicillin and augmentin are highly known for allergic reactions and allergy problems and things like that. So if you have allergies to penicillin, of course, you can't take penicillin, amoxicillin, augmentin. You can't do that. You would end up probably with a macrolide. Then there's the cephalosporins. Now, cephalosporins are really close cousins to penicillins. So if you have had a terrible reaction with the penicillin, you need to let your doctor know because they may not give you the cephalosporin. Keflex, Omnicef, Ceftin, and those things are cephalosporins. Tetracycline. Tetracycline is your doxycycline, minocycline, and the like. Those are tetracycline antibiotics. They're not in the family with any of these. The two that are closest related are cephalosporins and penicillin. Now, there are surgeries. I talked about surgery. If you were to have surgery, there's something called a balloon sinuplasty some doctors can do that in the office and some doctors do that in surgery. Then there's the functional sinus surgery, and that's pretty intense. All right. We are getting close to leaving out of here. So anosmia. Anosmia, I'm not going to stay on it too long, but that is where cranial nerve 1. And if you look at this slide closely, at the base of the skull, top of the sinus cavity, you'll see some yellow lines coming through. If you think of boiling spaghetti noodles, you put them in a strainer and you pour the water out and the noodles come through the little holes. That's the way the nerves come out from the olfactory bulb. If you have chronic sinusitis where there's polyps or something like that, those polyps may put pressure on those nerves. And if they do, it causes the nerve not to function. Similar to if you were washing your car and you had the hose, if you're standing on the side of the car where the hose is not impinged, the flow is great. You go to the front of the car, the flow is still great. Once you go to the other side of the car, the hose gets stuck under the wheel and you notice the water gets lower pressure. The water pressure gets lower because there's pressure against it. So when there's swelling in the nose, there's pressure against those nerves. It can make you not have the signal that you need to be able to smell. If your sense of smell is gone for a couple of weeks, maybe a month, 3 months, you can get it back. It is very difficult if it's longer than 2 years. However, there are some things that you can try, and that's olfactory training. You can get one of those kits. It's 4 scents, SCENTS, 4 scents: lemon, clove, eucalyptic, and rose. Lemon, clove, eucalyptic, and rose. If you do that for 20 seconds, twice a day, about 16 weeks, you may be able to get your sense of smell back. The people that had COVID and it affected their sense of smell because it affected that nerve, the olfactory bulb, they had a hard time. But they did find in studies that using lemon, clove, eucalyptic, and rose, doing it, smelling for 20 seconds, doing it twice a day, 3 times a day, for about 16 weeks, their sense of smell did start to come back. No guarantees, but you can try that. You can buy those kits off of Amazon. Don't get really expensive kits. They shouldn't cost any more than about $30 at the most, maybe $50. So, in conclusion, allergic rhinitis is an overreaction to allergens that causes the nasal tissue to swell, you to sneeze, and you to have congestion. You can treat it with nasal steroids, decongestants, and antihistamines. Remember, guys, men, don't take a lot of that pseudoephedrine because it can affect your prostate. Sinusitis, if you're having it for 10 to 14 days, 1 to 2 times a year, that's an acute sinusitis. Chronic sinusitis is if it goes past 12 weeks, and you may need to see a specialist because you might have to have surgery. Anosmia is the loss of smell. All right. Hopefully you've gained some things out of this, and we're going to see you next week, because next week we're going to be talking about the eyes. We're going to talk about how pollen affects your eyes, the effect of pollen on your eyes. Hopefully, your horizons have been enlightening.